Good evening and welcome back to the New York Immigration Coalition Test, Trace, and Take Care video series. My name is Lovely Tejada, the Manager of Community Engagement at the New York Immigration Coalition, and I will be your host. The NYIC has put together a series of videos to share information and resources about the New York City Health and Hospitals Test, Trace, and Take Care campaign and answer your questions. Next, we will deliver a presentation on some of the resources and services available throughout New York City, followed by an introduction to MetroPlus Health services by Richard Taylor and live questions from the audience. Keep New York safe by isolating at home and separating from loved ones and coworkers to stop the spread. Learn more here at nychealthandhospitals.org/test-and-trace/take care. If you watched our last video on contact tracing, you know that part of the conversation with the contact tracer includes recommending a range of services and resources, including food and medication delivery to the person they are working with. Contact tracers ask cases and contacts if they would like to be referred to a resource navigator for help with resources like food, medical care, and accessing medicine. The resource navigator calls them back within 24 hours to offer assistance to identify resource needs and promote available New York City services. Test and Trace Corps is providing Take Care packages to New Yorkers who test positive for COVID-19 and to their contacts. A Take Care package includes enough personal protective equipment for a household of 3 to quarantine for 10 to 14 days. This includes a medical grade mask, sanitizing wipes, hand sanitizer, a thermometer, and a pulse oximeter to help those who test positive for COVID-19 to monitor their oxygen levels. Your Take Care package includes face masks to wear when you need to be around others, hand sanitizer to keep hands clean, cleaning wipes or cleaning spray to disinfect surfaces, a disposable thermometer to monitor your temperature, snacks, games, and educational resources to make you smile. If you tested positive for COVID-19, they include a fingertip oxygen meter to check your oxygen levels. It also includes a guide to help you safely separate at home and how to use these items. Most people with COVID-19 have mild illness and can recover at home without medical care. It's important to follow these safety steps to protect yourself and others while you are separating at home. Wash or sanitize your hands thoroughly and often. Wear a face mask if you have to be around others. Clean commonly used surfaces every day. Do not share. Keep your things to yourself, especially in shared spaces like bathrooms. Find your own space. It's important to have a room where you can safely separate from others. Monitor your temperature and symptoms. And if you tested positive for COVID-19, monitor your oxygen levels with a fingertip oxygen meter. Stay inside. Do not go outside unless you need essential medical care. If you need to go outside to get medical care, wear a face covering and let your healthcare provider know ahead of time that you've been diagnosed with or exposed to COVID-19. If you need other medical care, try to speak with a healthcare provider over the phone or video. If you don't have a provider, you can call 212 COVID-19 and speak with a provider. Don't go to school, don't go to work, do not invite people into your home. Have groceries and other items you need delivered to you. Your contact tracer can refer you to a resource navigator for food delivery, or you can ask someone to bring these items to you. Protect the people in your household. Stay at least 6 feet from everyone in your home at all times. If you cannot stay 6 feet from others, wear a face covering. Stay in a separate room away from others. If you need to be in the same room, move around the furniture so that you can sit further apart. Sleep alone in a room that has a window with good airflow. If you share a bed, sleep head to toe or have one person sleep on the couch or floor. Use a separate bathroom if possible. And if you share a bathroom, clean anything you touch after each use. Wash your hands with soap and water for at least 20 seconds frequently, especially before touching other people if you're a caregiver, preparing food for others, or touching anything they will need to touch, like medicine. If you breastfeed, continue to breastfeed. Wear a face covering while breastfeeding and wash your hands prior to breastfeeding. If you pump, wash the pump parts with soap and water immediately and wipe down outside of the bottles if other household members will feed the baby. It's not always easy to safely separate at home if you live with others or have limited space to keep safe distances. The New York City Test and Trace Corp offers free private hotel rooms to help you separate from your loved ones for up to 14 days and keep everyone safe. Take Care hotels offer free round trip transportation to and from the hotel and any necessary medical appointments, private rooms and bathrooms, on-site COVID-19 testing, free Wi-Fi and cable TV, unlimited local phone calls to stay connected, breakfast, lunch, and dinner daily, medication delivery, interpreter services, on-site healthcare supports by skilled doctors and nurses, and telepsychiatry to access expert mental health providers. So let's walk through the process. Anyone, including the patient who's interested in staying in a hotel for 10 to 14 days, can call 844 NYC for NYC. Say you need a hotel because you have COVID, are experiencing symptoms, or were exposed to COVID-19, and you will speak with a nurse who will begin the screening process. A transfer to a hotel can happen within a couple hours. Hours of operation are 9 a.m. to 9 p.m. Healthcare providers cannot and will not ask you about your immigration status or social security number. The information is not collected. If you have questions about the program, please email hotels@oem.nyc.gov. If you need a space to separate from loved ones, call 844 NYC for NYC or 877 CVD 19 NY to book a room at a Take Care hotel. So here's some information about what the hotel experience is like. You'll meet with a social worker to learn what you will need to return home. Free meals delivered 3 times a day to your room, kosher, halal, vegetarian, and vegan available. Free Wi-Fi, cable TV, local phone, and air conditioning available. Your children or dependent elderly can come stay with you. You'll have regular wellness checks, access to video televisits with psychiatry if needed, and 24-hour nursing services for emergencies. You'll also have medication delivery, free transportation to and from the hotel if needed, and continuity of care, close coordination with outside partners. The client needs to be comfortable with staying in the room. And if someone self-discharges from the hotel, they do not call the police. That person can be re-referred via the initial pathway and be reconsidered. Guests should bring photo ID if they have any, 14-day supply of medication, any items necessary for their stay, and if they were recently hospitalized, bring the discharge paperwork and medication list too. Guests should not bring alcohol or recreational drugs. An online tour is available on the Health and Hospital site and on YouTube. If you have stayed at a COVID-19 hotel or utilized any COVID-19 New York City services, we encourage you to let us know your feedback. NYC Care is a healthcare access program that guarantees low cost and no cost services to New Yorkers who do not qualify for or cannot afford health insurance based on federal guidelines. All NYC Care services are provided through NYC Health and Hospitals. NYC Care is not an insurance plan. It's a healthcare access program that guarantees services offered by NYC Health and Hospitals to New Yorkers who do not qualify for insurance or are unable to afford insurance. NYC Care guarantees healthcare for New Yorkers regardless of their immigration status or their ability to pay. New Yorkers who are eligible for health insurance will be directed to the city's public choice health plan, MetroPlus, which we will discuss in more detail shortly. NYC Care is now available in all 5 boroughs. With NYC Care, you'll have access to a dedicated primary care clinician and your first appointment within 2 weeks of enrolling at one of NYC Health and Hospital's more than 70 locations, comprehensive primary and preventative care services, and access to NYC Health and Hospital's inpatient, specialty care, and behavioral health care services. You'll also have access to a 24/7 member service hotline, affordable prescription benefits, and 24/7 pharmacy access, a dedicated membership card, and a welcome packet and educational materials that helps members understand their benefits and responsibilities under the plan. You are eligible for NYC Care if you're a New York City resident and have been living in one of the 5 boroughs for at least 6 months and are ineligible for or cannot afford health insurance. How to enroll. Call 646 NYC Care. Your privacy and confidentiality are guaranteed. The healthcare professionals at NYC Health and Hospitals are committed to keeping your personal information private. They do not record information regarding your immigration status. Seek care without fear. Enroll in NYC Care today. Next, we're going to discuss ways to stay well once you've prevented transmission or recovered from COVID-19. Especially when it comes to our family's health, we need as much up-to-date information on COVID-19 and how to treat any lingering or long-term symptoms. It's more important than ever to lean on knowledgeable and vetted partners that are invested in supporting 360 degrees of your health and well-being. That's why I'm very excited to be partnering with Richard Taylor from MetroPlus Health today. MetroPlus Health offers low to no cost health insurance to eligible people living in Manhattan, Brooklyn, Queens, and the Bronx. They partner with New York City Health and Hospitals to provide primary and preventative care, emphasizing excellent services. Please help me welcome Richard Taylor, who will share a brief presentation on MetroPlus Health and its range of services.
Thank you, Lovely, for that introduction. So we can go to the next slide. Who is MetroPlus? So MetroPlus is a health insurance plan. We are a health insurance plan offering comprehensive medical, vision, and dental benefits of all ages and income levels. We are a wholly owned subsidiary of New York City Health and Hospitals, supporting health and hospital during this health crisis. We offer a public benefit corporation in New York City for 35 years, and we're not for profit, and we're here to serve the public. In 2019, Mayor de Blasio announced the launch of the largest, most comprehensive plan in the nation to guarantee healthcare for every New Yorker. We currently serve over 600,000 New Yorkers without insurance by strengthening New York City's public health insurance option, MetroPlus, and guaranteeing anyone ineligible for insurance, including undocumented New Yorkers, direct access to New York City Health and Hospital physicians, pharmacies, and mental health and substance abuse services through NYC Care, as Lovely mentioned earlier. Next, please. We offer MetroPlus has a range of low-cost quality products available to ensure you and your family. Most plans provide 10 essential health benefits, including primary care services, specialist services, dental care, vision care, pharmacy, family planning, maternity, hospitalization, emergency services, urgent care services, and telehealth. Next. We provide care coordination, meaning nurses meet the patients where they are, whether that be at home or in the facilities. We provide full support in addressing medical, safety, and socioeconomic needs. For people not capable of purchasing and cooking their own meals, we are able to coordinate delivery of food specific to their medical needs and preferences. We assist in identifying patients who qualify and may benefit from government-sponsored programs, and we assist the homeless with housing applications and Section 8 vouchers. In addition, we provide pharmacy case management to our members, which include in-home consultation by pharmacists. So why enroll now? Well, some types of insurance allow enrollment year-round. Medicaid, Essential Plan, Child Health Plus. Others allow for enrollment only during a defined period of time. Qualified health plans like QHP, also known as the ACA or Obamacare. Due to the COVID-19 crisis, New York State Department of Health reopened the enrollment for QHP as of March 16, 2020. This special enrollment has been extended through the end of 2020. Signing up by the 15th of each month will activate health coverage starting the first of the following month. Next, please. What's the right plan for you? The type of plan you qualify depends on your family situation, your age, your income, employment, and residence status in the United States. Many low-income New Yorkers may qualify for $0 or $20 a monthly payments for comprehensive health care with a full array of health benefits. Children up to the age of 19 qualify for Child Health Plus plans, regardless of their legal resident status in the U.S. Monthly payments depend on the parent's income. So what can we do for you? Why should you enroll? Affordable for low-income New Yorkers. You have access to tens of thousands of providers in New York City. A peace of mind at a tremendously stressful time for you and your family that comes with knowing you are covered. You can manage your health remotely through our member portal, receive important health text reminders and alerts, see doctors 24/7 on your smartphone, tablet, or laptop, get access to urgent care, and much more, including PillPack, our member rewards program, and many extra services to help you keep healthy and strong. The numbers on the screen will let you know how to get in contact with us. You can contact me, Richard Taylor. I'm the Associate Director of Manhattan Sales Manager, and my contact information is on the screen. Audrey Bonanno is our Central Manhattan Supervisor. Hader Restituya is our Manhattan Sales Supervisor for the Central Manhattan area, and Rudy Lubin is the Manhattan Sales Supervisor for South Manhattan. So at this time, I'd just like to pass it back to Lovely, and thank you for the opportunity.
Well, thank you so much for the presentation, Richard. That was incredibly informative, and we're grateful for your partnership.
Thank you.
Next, we will provide some additional resources to help you and your family stay healthy. Staying well. Go to an emergency room or call 911 if you have symptoms such as trouble breathing, persistent pain or pressure in the chest or abdomen, new confusion or inability to stay awake, blue lips or face, difficulty speaking, sudden face drooping, numbness in the face, arm or leg, seizure, any sudden and severe pain, uncontrolled bleeding, severe or persistent vomiting, or diarrhea. Call 212 COVID-19 if you do not have a healthcare provider. You can get care regardless of your immigration status or ability to pay. Seek mental health support if you need it. It can be distressing to learn you were diagnosed with or exposed to COVID-19 and will need to remain physically distant from other people. There are resources available to all New Yorkers to help during this difficult time. Resources are available regardless of immigration status or insurance coverage. NYC Well offers 24/7 well-being and emotional support. For free counseling, call 888 NYC Well. Text WELL to 65173 or visit the NYC Well webpage to chat with a counselor. You can also call New York State's COVID-19 Emotional Support Helpline at 844-863-9314 to talk to specially trained volunteer professionals. Do you have concerns about family violence? Call 1-800-621-HOPE or 1-800-621-4673. To speak with a trained counselor who can provide confidential crisis counseling, safety planning, and connect you to a confidential, safe place to live. If you need access to food, a resource navigator from the Test and Trace Corp can help connect you to free meal delivery. Please call the Test and Trace Corp callback number, 212-242-2692. And press 3 for Resource Navigator. You can leave a voicemail and someone will call you back. Alternatively, you can call 311 and say get food or visit nyc.gov/get food for information about the closest food pantry to see if you are eligible for free meal delivery. Speaking with a contact tracer will not impact your ability to apply for permanent residency or a green card. If you have questions about your immigration status, call the Action NYC hotline at 1-800-354-0365 and say public charge from 9 a.m. to 6 p.m., Monday to Friday, to get answers to your questions. Do you need access to healthcare or health insurance? Call 311 or text covered NYC to 877-877. And to speak with an aging specialist, older adults can call 212-AGING-NYC or 212-244-6469. And that concludes the presentation. Now we'll take a few questions from the chat. How can I get a Take Care package? New York City Health and Hospitals announced as a part of the Test and Trace Core that Take Care pillar that it'll provide Take Care packages to New Yorkers who test positive and their contacts of confirmed positive cases. So the Take Care packages will include a medical grade mask, sanitizing wipes, hand sanitizer, a pulse oximeter, and thermometer. The Test and Trace Corp Take Care pillar ensures that all COVID-19 positive New Yorkers and their contacts can safely separate to prevent the spread of the virus. Who are resource navigators? The Take Care program partners with 15 community-based organizations across the city to offer resources to New Yorkers isolating at home. Resource navigators help New Yorkers connect to resources while safely separating in their homes, like food, medicine, healthcare, and social services. Since June 1st, resource navigators have reached out to more than 8,400 New Yorkers with COVID-19. Over 200 resource navigators in communities across the city are supporting and providing normalcy to those with COVID-19. And through this work, resource navigators have connected with 88% of client referrals via phone. How can you protect yourself if you live with someone who has COVID-19? Don't have visitors in your home. Sleep head to toe if you share a bed with someone who is sick or sleep on the couch. Keep people who are sick separate from those at risk for serious illness. Cover your nose and mouth with a covering and stay 6 feet from each other. Cover your cough and sneeze with a tissue or inner elbow. Throw tissues in the garbage immediately after use. Wash your hands for 20 seconds often, especially after you cough and sneeze. Frequently clean common surfaces such as doorknobs, light switches, faucets, phones, keys, remote controls. Don't share any glasses or utensils. Wash towels, sheets, and clothes at the hottest possible setting and dry completely. Can I call to admit myself into a COVID-19 hotel? Yes. Anyone who is interested in staying in a hotel for 10 to 14 days can call 844-NYC for NYC or 844-692-4692. And when you call, say you need a hotel because you have COVID-19, are experiencing symptoms, or you were exposed, and you'll speak with a nurse who will begin the screening process. A transfer to a hotel can happen within a couple hours. You should bring photo ID, 14-day supply of medication, and any necessary items for your stay. For Richard, is this enrollment plan for any New Yorker regardless of status?
Well, there are certain qualifications. So we have plans that cater to all New Yorkers. So as I mentioned on the presentation, as well as Lovely, New York City Care, as well as health and hospital options are available to individuals if they are undocumented. However, as being the plan for the city, anyone that looks to get insurance will have viable options. based on their eligibility requirements, which could be, whether you're citizens of the state, you're an immigrant to the country. But again, if you're documented or non-documented, there's a plan to suit your needs.
It doesn't look like we have any more questions in the chat. So I'd like to thank Richard again for joining us, and I thank you for tuning in. Our next video will be on November 19th, 2020, right here on Facebook Live. You can download and share our Test and Trace two-pager available in Arabic, Bengali, Creole, Mandarin, Spanish, and Russian. And to stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, and Twitter, and text NYIC to 52886 to stay up to date with our actions and campaigns. Stay safe and enjoy your evening.